Good evening. After what feels like weeks of ever-rising COVID cases, there was a glimmer of hope today with the news that across every borough of the city, the numbers are finally starting to fall. But there is still a long way to go because the latest figures on vaccinations show that London is lagging behind the rest of the UK. In fact, we have the lowest vaccination rate in England, but there are plans to increase the supply this week. And there's a bit of confusion over whether or not they could trial 24/7 vaccinations here. Our political correspondent Simon Harris will have more on that in a moment. But first, more on that drop in cases.
London got a second vaccine hub today, but in the race to give everyone a jab, it's still lagging behind the rest of the country. Fewer than 500,000 Londoners have been inoculated. The new mass vaccination centre in Wembley should help.
So the plan is that this centre will vaccinate 6,000 people per day. We've started off on one floor, there's 3 floors, and every week we'll expand and open another floor.
The first patients to get a jab today were mainly the over 80s. By the end of the week, this will be one of 176 vaccination sites in London. At Excel, people are inside, standing in a line, waiting to be inoculated. But here, the queue will be in a tent. Luckily, on this chilly Monday, no one had to wait in the cold. But this was day one, and it will get busier. London's mayor dropped in for a visit. He's worried some communities are wary about the vaccine.
It is a fact, I'm afraid, that there are too many black Londoners, too many black Asian minority ethnic Londoners who are hesitant about taking this vaccine. And my message to them is I wouldn't be here at this Max vaccination centre if I didn't believe the vaccine was safe. You must be relieved.
There was a glimmer of hope today that the tide might be turning. All 32 London boroughs have seen a fall in the infection rate. A week ago in London, there were 1,058 new cases of COVID for every 100,000 people. Today it's down to 811 cases per 100,000. That's a drop of 23%, or almost a quarter. Hospitals in and around London are still under extreme pressure. At Watford General, they've been so overwhelmed, patients have been transferred to hospitals as far away as Nottingham and Leicester. But in the intensive care unit, they're hoping the spike in admissions is flattening.
Feels like we're in a plateau at the moment. The last week or so, our numbers have held. But I mean, the numbers are huge. We've doubled the first wave. We've had about 350 patients with COVID in the hospital.
The first few weeks of 2021 have been traumatic for patients, families and staff.
We've lost people that we shouldn't have lost because people won't stay in, people won't follow the rules, and this is where we are, and it's just soul destroying. Honestly, it's just so heartbreaking.
Rob Orton is 48 and a dad to 2 boys. He's unable to talk following a tracheotomy, but he can write. Been in a long time, I'm slowly getting better thanks to Watford Hospital. John Raby is also grateful. He and his wife both went down with COVID over Christmas. Today he was well enough to be discharged.
It was tough. It was really tough. And they were great. Absolutely great. They kept me going when I didn't want to keep going.
The number of new cases might be slowing down, but hospital intensive care units are still full of COVID patients who are very, very ill.
It's quite an emotional film there, Simon, and just shows why we do need this vaccine. So what are the chances of us getting that 24/7 trial?
Well, this morning the Vaccines Minister, Nadhim Zahawi, said London would be piloting 24-hour vaccinations in hospitals by the end of the month. But later he seemed to row back from that, suggesting it might not be London, it might be the Midlands, which was slightly confusing. Now, you might think that with such high infection rates that there are in London, it would be a good place to have round-the-clock inoculations. And certainly the Mayor thinks so, so he says he's going to be pushing for London to be included in the pilot. We don't yet know from the Department for Health whether it will be or won't be. We asked them to clarify it and they couldn't.
OK. All right, Simon, thank you. Good evening. We start tonight with another grim statistic. More people are in hospital with coronavirus right now than at any point during this pandemic. Almost 8,000 people are currently being treated in London's overstretched hospitals. The case rate is coming down, but there's a long way to go before the pressure eases. New research shows 1 in 6 Londoners have had the virus. Our political correspondent Simon Harris has the details.
Infection rates are beginning to drop, but there's no respite yet for hospitals. In London alone, there are almost 8,000 COVID patients in hospital beds. More than 1,200 of them are unconscious and on ventilators. That's more than at any other time since the start of the pandemic. And new figures suggest 1 in 6 people in London has had the virus, a greater percentage than most other parts of the country.
The big point for me is that to get out of this mess, we need 70, 80% plus to have antibodies. So we just need people to go out and get their vaccine.
Staying at home might be one way to avoid COVID-19, but for many Londoners, it's not an option. This was an overground train in North London during this morning's rush hour. Social distancing isn't always possible. Jenny commutes to work by bus, even though it scares her. She's a cleaner at London South Bank University.
What choice do I have? Go home and don't get paid or don't get any money? And maybe gonna lose my job because I refuse to come to work? That's my choice. Or come here, expose myself, and maybe I'm gonna lose my life if I get sick. You don't know.
Tony works at another university, UCL, as a security guard.
My fear is I will be infected, and likewise my colleagues, I'm scared to go to work.
What would you like to happen?
More protection, provision of equipment, PPE, and support, psychological support.
Tonight, London South Bank University said it provided a safe and secure working environment for its contract cleaners and was grateful for the vital work they do. UCL said its cleaning and security staff were provided with PPE, and there were a large number of measures in place to ensure the campus was as safe as possible. But the union, which represents many low-paid workers in colleges and universities, believes more of them should be at home.
We're calling for the closure of all non-essential buildings, all these workers to be put on furlough. That's what it's there for. Help stop the spread, put the workers on furlough, keep them at home, keep them safe.
Building sites like this one in Canning Town are evidence that for some parts of the London economy, it's almost business as usual. Workplaces might be COVID secure, but many employees are left with no choice but to use public transport, and that carries its own risks. Simon Harris, ITV News.
OK, returning to coronavirus, and while doctors continue to care for huge numbers of patients in London's hospitals, there are concerns about the long-term impacts of this pandemic. Harlow's Conservative MP Robert Halfon has warned of an epidemic of education poverty and a mental health crisis among children. He spoke to our political correspondent Simon Harris.
Well, I'm very worried that long after the coronavirus has gone, that we will face an epidemic of educational poverty and a mental health crisis in our country.
There's been a lot of focus on teenagers doing exams, but of course 6-year-olds who are losing a year of schooling now won't be out of the school system until they're 18. Even then, they could still be suffering from this.
Well, this is the problem. It's having an impact not just on those pupils doing exam years, but all the way through the school and education, college and university.
The Education Secretary, Gavin Williamson, has presided over some difficult decisions. There's been the exams fiasco, school meals, school laptops. If you had to give him marks out of 10, what would it be?
Well, I think I've learnt over the past year, given what happened with the exams and grading, not to be someone who gives people grades, and I don't want to focus on individual personalities.
Do you think he's up to the job?
I think that he's firefighting because of the coronavirus, and I think it's very difficult for any government minister. Clearly things have gone wrong. I mean, there's no doubt about it, particularly the exams controversy that you highlighted.
Can I ask you about your experience of coronavirus? You have cerebral palsy. You have been shielding for an awful lot of it. How's that been for you?
Clearly it's, I'm lucky I have a job. I have a secure job security, at least until the general election. Thousands of my constituents in Harlow and millions of people across the country don't have that security and have lost their jobs and their livelihoods, or have had to cut down their hours, and so are losing valuable income. I've learnt to walk up my stairs when I used to have a chairlift, which is a wonderful thing. So in some ways, there's always a silver lining to every cloud. I don't just want a route map out of education, but I want the Prime Minister to provide an A to Z, to literally get an A to Z out, get out there one afternoon on television and say this is the route map out of coronavirus once the vaccinations come through.
And you can hear more of Simon's interview with Robert Halfon on his political programme, The Late Debate, after news at 10. He'll be joined by MP Stephen Hammond, Munira Wilson and Rushanara Ali, where they'll talk about who should be next in the priority list for vaccines.